Hello and welcome to today's podcast. What I want to talk about today is insurance carriers. Insurance carriers in personal injury work don't have to be your adversary. As a matter of fact, the insurers can be really good to you as far as a provider goes, and you can have great insurance relationships. Now, what great insurance relationships look like in the personal injury market is that you have very smooth billing processes. So what I mean by smooth billing processes is that you bill and get paid for what you do. Now, we all know in the personal injury realm, and I know for the longest time myself personally as a private practitioner, you'd start to fight and constantly feel like you were fighting insurance carriers. I had a big aha moment about 8 years into my private practice, 9 years into my private practice, 10 years, somewhere in there. I practiced for 17 years total. But in that 9-year period, I had an aha moment. And the aha moment was that the insurance carriers were pretty much paying for everything that I had. And that the insurance carriers in personal injury wanted exactly what I wanted as a doctor. What did I want as a doctor? Well, first of all, I wanted to treat a lot of injury patients. So I wanted to draw a lot of injury patients, and the way I did that was I got really good at getting physical results. I also got good, how I got good at getting physical results, or how any doctor gets good in the market today of getting physical results. If you're out there right now getting good physical results, chances are that you're doing a pretty good job with diagnosis. Now, in the area of spinal ligament injury diagnosis, we know that there's a real deficit of doctors that can do a really good spinal ligament injury workup. We know that's true in the market today, and we also know that's what drives the statistics down in the market. What I mean by that is that's why research tells us that 50% of those that are going to be in an auto accident, 50% of them never fully recover, and 30% of those actually have significant changes in their life due to disabilities that actually occur as the result of their injuries. That's what research tells us today. So, what does an insurance carrier in the personal injury market want? Well, it's really simple. They want the same thing that the personal injury attorneys want. They want the same thing that the patients want. They want a doctor that diagnoses all of the injuries, does a stellar job, doesn't miss injuries, knows how to diagnose ligament injuries, knows the difference between a disc herniation and a non-disc ligament injury, knows how to image them, knows how to work it up, knows how to clinically correlate for a motor sensory or a pain problem at that area, and knows how to treat that to really good results. Now, that's what the insurers want. The insurers want you to be able to diagnose the injuries really well and then treat the patient to a really good result. Now, what's a good result? Well, if I'm a patient and I'm referring a patient, let's say the patient had a back injury, lower back injury, they've got a ligament injury to the lower back, or they were in an auto accident, they got a ligament injury to the neck. If I'm referring to a doctor, let's say it's a family member of mine, here's what I want: a doctor that's really good at diagnosing the problem and really good at jumping on it, getting a great start with applying procedures that are going to minimize the risk severely of long-term residual complaints with that patient. In other words, you want the patient to fully recover, no pain, no residual symptoms of any kind. You want no activity of daily living deficits at all, and you want no interference with their ability to earn a living. That's what you want. That's the ideal scene as far as with treatment of a spinal injury patient. Now, that's exactly what the insurance carrier wants. Now, that's not what the insurance carriers are getting in the market routinely. That's what we, myself and others that are producing smart injury doctors, that's what we're putting into the market. That's what we're saying is the big emphasis. And doctors, or anyone listening on this podcast today, whether you're an attorney, a patient, or a doctor, or an insurer, the market, the 2020 and above market will dictate that's what has to occur in the market. So the better the doctors get at treating the patient and the better they get at the physical injury results, the less hardships they're going to have with insurance carriers, because insurance carriers will start to profile you and actually say, okay, great, this doctor is doing a good job. The documentation is solid, the injuries are solid, the identification and diagnosis of these injuries is solid. There's no overutilization of procedures, there's no stacking of procedures just for the for the ability to stack procedures. Everything's very logical. And they have really good outcome assessment procedures to determine the patient is making great progress. They know when maximum medical improvement is. It's very clear in their documentation to see. Doctors or anyone in the market today that's having trouble with personal injury insurance carriers, usually there's about 3 things that are a problem. One is your injury diagnosis is lacking. 2, your documentation is lacking. Those are the 2 biggest areas. And then 3, you can have some billing issues depending on how you're billing. So those are some of the main things that doctors run into. And it doesn't matter if you're an orthopedic doctor or if you're a chiropractic doctor, or you're a doctor of physical therapy, you're a physical therapist. It really doesn't matter. That's what it comes down to. Because insurance work on the other side is very easy. They want to know, what are the injuries? Okay, is there any permanency to these injuries, and how did you determine that? They want to know, is there anything that the patient, as a result of this now permanent injury, are there things that they do that cause them discomfort? Those are called duties under duress factors. Or are there things that this permanent condition has now cost them the ability to do? In other words, they no longer can enjoy doing this at all. They used to be able to ride a bike for 5-10 miles. Now, due to their back injury, they can't get on a bike at all. I mean, it hurts far too bad to get on a bike because of the injury itself. Those are called loss of enjoyment of life factors. So those things have to be documented. Documentation in personal injury is probably the simplest documentation that there is. But a lot of doctors simply don't know what are the factors that the insurer needs. And the factors that the insurer needs are the same factors that you would need if you were paying the bill. So all you have to do in order to really understand the carrier is to put yourself in the carrier's position. Treat the carriers how you yourself would like to be treated. And you know what? In time, the carriers will treat you that way. It's just that simple. Adversarial relationships with insurance companies are futile. You might as well, there's no reason to do it. Now, if you're a doctor that wants to be on the expert witness side of things and you want to constantly be arguing and you enjoy arguing, then you're going to continue to practice that way. But we teach doctors, and in my experience, doctors don't want to spend a bunch of time arguing with insurance carriers. They really don't. They want to have good relationships, and good relationships are really easy to accomplish. Again, 3 things you got to do. You got to accurately and objectively document the patient's injuries. Usually that's lacking in most documentation. You have to treat the patient to a good result, preferably a great result. And you have to document in such easy and simple fashion that it's easy for everyone that's trying to determine the benefits for that patient to do so. Whether it's the insurance carrier, the plaintiff attorney, the defense attorney for the insurer, it doesn't matter. You want to put your documentation in a way that is simple and easy for everyone to understand. And again, that's oftentimes not in the market today. That's what we're creating today, though, with smart injury doctors. They diagnose well, they treat well, and they document in a stellar fashion so the patient has access to any benefits they may be entitled to, and it's easy for those that are adjudicating what those benefits are. It's easier for them to do their job. So when you can produce in the market exactly what everyone in the market needs, what the patient needs, what the insurer needs, what the attorneys need, then you have truly a stellar and a very much less stressful personal injury practice, and that's very easy to accomplish today with the right understanding. Most doctors understand very well, and there's just little tiny things that they're doing that are causing friction in the process, and those can be easily understood and easily corrected. And that's what I wanted to talk about in this podcast today, in this program today. I hope you got something out of this. Again, 3 things you got to be able to do well: document, treat, and diagnose. So doctors, thank you very much for taking the time to listen to this short podcast today, and I look forward to seeing you on the next program. Thank you.